specific case, how we take a molecule from the laboratory all the way through into clinical trial, and how it requires a multidisciplinary team, another word that we've used often. And for the young students, I'm going to demonstrate how science can become obsession, because I'm going to talk about a molecule which has driven people mad, so it comes with a certain health warning. The basic idea that we're going to use this is a prodrug therapy. This is trying to use some aspect of cancer biology so that the tumour itself might be able to use its own biochemistry to selectively activate an anti-cancer treatment so that we spare normal tissue, and we hope side effects, and increase the targeted effect of the anti-cancer therapy on the specific tumour. And this is a molecule that we're going to talk about, CB1954. It's, I'm now outlining a molecule, it's a dinitrobenzamide. And what we show is that subsequently it can bind to and cross-link strands of DNA. So if you think of this rather cruciate sort of format that I'm taking, this can bind to and cross-link DNA. The clue to the obsession is the 1954, because 1954 is when this molecule was first developed, and it's taken us almost 50 years to understand how we can best apply it in the clinic. And again, strong sense of Kleck's discussion in that we need to be patient and persevere. And I like his idea of teaching old drugs new tricks. This is a very old drug. The problem, the obsession came with a simple empirical observation against a rat cancer cell line called the Walker carcinosarcoma. CB1954 is the most active anti-cancer agent ever found. And in the old days, this was a very common cell line that was used for screening for new anti-cancer drugs. So if I were a rat cancer doctor, I would be king. I can cure all rat cancer with this compound. And because it was so incredibly effective, this is what obsessed people with trying to find out, can we find a human cancer that's equally as sensitive as this target cell line? And this was a continued subject of interest for a great friend and mentor of mine, Professor
بيقول لك
Tom
التيومر
Connors.
ده
So he
عارف
passed
اعالجه في
his
الفئران، فبيقول
obsession
انا لو دكتور فلان
on
دلوقتي
to
كان
me
زماني هبقى
and to
ملك.
some of our generation to try and understand why this drug was
هو
so
ده
effective
هو
in
دلوقتي عمال
rat,
بيشرح في نقطة، عايز
but
يقول لك
so
ازاي
completely ineffective
البحث
in
العلمي
humans.
هو
Here's an
يجننك تبقى انت
example
عايز
of it.
توصل لحاجة.
This is looking
يقول
at
لك
a
احنا
plot
دلوقتي
of
450 عالجنا التيومر بتاع
concentration
الدرج
of the
بالفعل،
drug in a logarithmic
فاحنا
scale
اكيد
against
التيومر بتاع زماننا
percentage
هيتعالج.
cell kill. Here's a rat line, and we require about 100,000 or 1,000,000 times more drug to kill a non-related cell line. And eventually what we discovered was that in the rat, this drug CB1954, an inactive prodrug, was converted by this enzyme here, a quinone reductase called DT diaphorase, using this complicated set of electron transfer. So it converted relatively non-toxic CB1954 through a process of reduction to a very active cytotoxic species that will bind to DNA. So there was the enzyme. And this allowed us to go on using DNA technology to clone the enzyme, NQ01. And what we found was that at last we could satisfy Tom Connors' search for the truth. And why was this drug so effective in the rat but not in human? And it lay in a single nucleotide change, resulting in a single amino acid change, which completely altered the enzymic activity of this NQ02, this NQ01, the DT diaphorase. So all of truth lay in a single mutation, and that's what separated man from rat in terms of this enzyme. So what that led us to do is to say, rather than just say we've spent 30 years researching a negative finding, can we use that information and look for other enzymes using clever DNA technology that might be better at activating CB1954? So can we take something positive out of what was effectively a negative observation? And again,